COVID-19, a challenge for civilization. Stuart Kaufman, medical doctor and scientist for over 50 years, is a MacArthur Fellow and author of hundreds of articles and 6 books. Here are his perspectives on COVID-19.
There are really two essential ideas that I think are not well known that I want to get across.
Idea 1. Social distancing works only if 100% of the population complies with social distance at least 80% of the time. Idea 2. The rate of spread will be either exponential if 80% compliance is not maintained, or if it is maintained, a logistic curve will emerge, slowing the spread. What is the difference between these two predictions?
If we do nothing to socially isolate, COVID-19 will spread and grow exponentially fast. It will just go and keep going up. If we do social isolation at the level that's effective, COVID-19 will increase and then it will level off. And this disease will stop spreading. This is happening now in China. It's happening in Italy. We can make it happen in the United States. If we get control of COVID-19 and the outbreaks slow and stop, as they have in China and in Hong Kong, we haven't won yet. Already there's evidence that post-shutdown in Hong Kong, the disease is starting to spread again. We will not solve this for a long time until we have a vaccine and the population of humanity is well vaccinated. The next thing I want to tell us about is a study that was done at Imperial College in London by Ferguson et al., March 16th. They estimate for the UK and the US that if nothing is done and the disease spreads exponentially, in England about 500,000 people will die. In the United States, 2.2 million people will die. There are 7.8 billion of us. In the worst case, when this spreads, a very approximate numbers that on the order of 50 to 55 million people could die. To scale this for us all, World War II saw 40 million people die. It is imperative that we understand that with sufficient social isolation, so the disease switches from exponential to logistic and saturates, we can dramatically drop the death rate from something like 50 million to very much less than that. I'll get to it in a moment.
So what is it about 100% of the population complying with 80% social distancing? Why does that number matter so much?
This is figure 2 in the Ferguson study, and the different curves are showing the effects of different degrees of social isolation, from closing schools to people staying at home to shutting down different organizations and so on. And again, this is dates from March 20th, April 20th, May 20th, and so on. The red line is emergency bed critical care units in England. It's a flat line. If the curve goes above the flat line, hospitals will be overwhelmed and they will not find beds, they will not find oxygen, they will not find people able to take care of them. In short, this is the fear that our medical healthcare system, in England in this case, will be overwhelmed. Notice where the red line is. The message is that we can bring the curve down significantly, their study shows, and lower the peak and delay it if we use all the social isolation mechanisms that we have. Well, that's happening right now in Europe. England has gone to lockdown, perhaps because the Prime Minister, Boris Johnson, saw the study of the group in Imperial. We are at an extraordinarily dangerous moment. It is time, for example, for the governors in the United States to have their hands on these two studies, for everybody in Congress to have their hands on these two studies. I'm now going to show you Gabor Maté's analysis that came out 2 or 3 days ago, looking at the actual events in China and now in Italy. So what Maté did is he looked at what happened in Hubei province in China, and he is plotting on the y-axis here the rate of spread of the virus per day. So it starts at 15%. That means that each day the number of infected, this is actually deaths, but it's the same thing, the number of infected is going up by 15%. But what is happening, which is the huge hope, is that as the disease spreads, because it's now logistic and it's spreading in isolated pockets, the rate of spread of the disease slows from 15% to 10%. I'm now going to show you the same results for daily growth rate of deaths as a function of the cumulative number of deaths in Italy, and we're seeing the same thing. It starts in Italy spreading at about 25% a day, and it gradually trends downward in that data, as you can see, so that by, in this case, 2,500 deaths, what a horrible thing to be using as a marker, it's dropped from 25% to 15% spreading per day.
Here's a way to visualize what these two predictions will result in: exponential or much slower logistic growth of the disease. Stephen Guerin, a computer model expert, thinks of it this way. Imagine a dense forest, a fire breaks out, and because of that density, the whole forest burns down. Now, think of a sparsely treed forest. The fire cannot spread because of the distance between the trees. It's just like the way COVID-19 spreads. So, you can see that at some critical point, that distancing of trees or people makes a vast difference. What does 80% mean about the virus spread? Think of it this way. 100% of the population spends 80% of their time at home. This breaks down to 1 or 2 trips to the grocery store, the pharmacy, or the gas station, or perhaps walking your dog once a day. Being outside is okay as long as you can maintain the social distance of 6 to 8 feet away, like in a park or a hiking trail. This Japanese video shows of the spread of droplets that are expressed when someone coughs or even speaks loudly. We clearly see the range of distance that needs to be observed when we are around other people. We also see that a mask can prevent this droplet spread along with social distancing, which provides us with added safety. The experts who track the change in the spread of the disease can tell us when the disease has changed from an exponential to a safer logistic growth. The percent increase of the spread of the disease per day will slow. We will need to maintain 80% social distancing until the spread stops.
We need to do everything we can to encourage such efforts on a maximum scale.
COVID-19 is currently infecting more than 1 million Americans and has claimed 59,000 lives in the U.S. and, worldwide, 220,000 dead. Social distancing works only above a phase transition or threshold of 80% of the entire population. Below the threshold, COVID-19 explodes exponentially with a large loss of life. Above the threshold, COVID-19 grows logistically with a much smaller loss of life. We can assess in any locale if the disease is growing exponentially or logistically and respond. If COVID-19 is growing exponentially, COVID-19 admissions and deaths in hospitals in that locale increase at an approximately fixed percentage over time. Action. Increase social distancing with isolation, quarantine, and assure compliance in that locale. Communicate clearly with the public that compliance is crucial. If COVID-19 is slowing logistically, the percentage in COVID-19 admissions and deaths in hospitals in that locale decrease over time. Action. Hold social distancing steady or adjust carefully in that locale until the disease stops spreading. Communicate clearly with the public to maintain social distancing. Social distancing works. California was shut down on March 20th at an exponential growth of 22% per day over the 2 weeks centered around March 20th. 7 days after shutdown, the rate of growth dwindled to a logistic pattern for a week, then leveled off at a 3% slow exponential growth per day. While encouraging, we are just learning to use such data. Care is needed. As we structure the reopening of our economies, we must balance it with the potential resurgence of the virus. We can achieve this balance in any location by monitoring if the growth is a very slow exponential rise, perhaps increasing at 1% a week or less. At this level, we can probably sustain that until we are sufficiently vaccinated. If the growth is dwindling logistically, we can probably afford to open the economy a bit more.
It is correct to say that we are globally at war with COVID-19. It is profoundly correct to say that we, as a species, in our global economy at 100 trillion a year and growing, have unleashed this pandemic along with climate change and mass extinction. We're in a war. Let me compare this to the year 1941, August 9th to 11th. President Roosevelt boarded the USS Augusta battleship and cruised north to a bay off the east coast of Newfoundland. Winston Churchill, as Prime Minister, took HMS Prince of Wales and crossed westward to the same bay. Roosevelt, suffering as a child from polio, struggled his way across to the Prince of Wales. The two statesmen, in the early days of the war, 1941, before the United States had entered the war, while England was in the midst of the Battle of Britain, sat and talked and made 8 major points for the post-war world. That 8 major points became the Atlantic Charter, which led to things like the United Nations. We are now in the early days of this war. We have the choice as a species, aware of one another, of what to consider for the post-COVID-19 climate change, mass extinction, war that we have caused. It is time for humanity to come together and figure out how to live on the planet as children of the biosphere, not above the biosphere, to rape and pillage as we will. It's time to begin, over the next decade, to consider something that, to be grandiose, we might call a global charter that we ourselves create.